This is our final 15th tutorial in Pathophysiology course. Today I'm going to finish my school scouting system because we remember that I have left a few topics to discuss, and also I'm going to go through the about skin disorder and also um, fluid and electrolyte disorders, just main disorders and just disorders, not pathophysiology and not physiology. Sorry. So let's see. Let's wait for the students who will join me today. Okay, wait a few minutes. It's final tutorial and to be really disappointing. None of them join me, but okay, if none of the students will join, um, I will conduct tutorial of course, and it will be recorded, and maybe they will watch. Let's see. Let's wait 5 more minutes. So. Hello, Abid. How are you?
Hey, Professor, just a second. Yeah, hi. Can you hear me? Hello?
Yeah, now, yes. Yeah.
Okay, nice.
Okay. Okay, man. Um, okay, so today we have our final tutorial. 15th tutorial, sorry. Of course, it's quite emotional, of course, for me, um, because 15 weeks and 15 meeting is not, um, I mean, it's quite a lot. Um, uh, so, and this course was important for me also because and interesting also for me. So what we are going to do today, you remember from the previous tutorial that we have left some disorders, actually two disorders, gout and low back pain to discuss. So we will finish those disorders, and also I have planned for today to cover uh, skin chapter and the liquid and electrolyte chapter, but just few disorders. I'm not going to discuss them in detail because we will not have time, and also at the same time, those topics will not be included second midterm, which you will have this Friday, but those topics will be included in final exam, so there will be the questions about them, so it's also important. I have also questions prepared as always about musculoskeletal system to assess your knowledge, and we can do together different activities um, to see how well you remember previous chapters, which are and which about which you will find the questions in second midterm. So yeah, so that's my plan for today, for the final tutorial. Let's see. Maybe Solomon and Yazan will join us. Uh, okay. You have the tutorial. You have the midterm Friday, 11 o'clock, I guess, and you will have a final exam on 10th of August, as far as I know. As far as I know, but you will be informed about it. Okay, let's start presentation. Abed, you can hear me? Do you?
Yes, yes, I do. I can hear you, yeah.
Yeah,
I can hear you, yeah.
yeah. So you can hear me clearly, or because I have open, my window is open. So should I close it, or is it okay?
No, I think it's all good. I have noise with it
Okay,
silent
okay,
version.
okay. Yeah, because it's very hot outside. It's a little bit windy actually outside, but now, but whole day it was quite high temperature, I guess. What about in Israel? I guess in Israel you have very hot summers, I guess, yeah.
Yeah, it is hot. Yeah,
Yeah,
very hot actually.
yeah. Do you live in which city do you live?
It's a small town called Baka. It's like you can say it's in the center of the country. So
What's the name?
it's called Baka, Baka Al Garbiya. I will
Baka.
type if you want in the chat.
Okay. Yeah. 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 Baka Larka. Okay. Mhm. Yeah. Mhm. Mhm. Okay, man. You are not Jewish, right? You are Arab, right? I mean,
Yeah. Mhm.
sorry.
Yeah, that's correct.
Yeah. Okay. Okay. Yeah. Okay, man. Um. Yeah. So we can start. We can start. Uh, so I will open my presentation about musculoskeletal system. Yeah, and the first disorder I want to speak about is gout. Uh, have you ever heard about this disorder, Abed? What do you know about gout? You may not heard, or you just heard and don't know
Yeah,
much about it.
yeah. Actually, this is the first time for me hearing about
Oh,
it.
okay. Yeah, okay, man. So this is quite it's common disorder actually, not that common, but I'm sure that you may see the people who have this disorder in their life. So it's of course some, um, disorder which affects different joints and soft tissues. So what's happening during gout? So this is crystal-induced arthritis. Oh, sorry, I think I should close the window, at least half closed. Okay, okay. So, Abed, you can see my presentation, right?
Yes, I do.
Okay. So it's crystal-induced arthritis, and it's inflammatory disease. So why is it called crystal-induced arthritis? Because uh, crystal depositions. There are crystal deposition of the sodium salt of uric acid. So uric acid crystals are deposited. The depositions are found in the joints, and this excessive amount of uric acid crystals causes inflammation locally, and there will be picture of arthritis. So patients will have pain, dolor, there will be local edema, there will be redness of that area, there will be locally increased temperature. So this area will be, there will be hot area, I don't know how to say. So the patient experiences intermittent episodes of joint pain due to the uric crystals. So one of the most common symptom is the pain. Um, Uric acid is a base and a very important thing when we are talking about the risk factors and causes of this disease. So we know the pathogenesis. So pathogenesis is that uric acid crystals are accumulated, excessive amount of crystals are accumulated in joints that causes inflammation of the joint and all the manifestation of the inflammation. So what's the reasons, what the causes of the excessive production of uric acid? Uric acid is normally produced by the degradation of the proteins. So if the patient have the diet rich of protein, they have the increased chance of development of gout or exacerbate the gout. So protein-rich diet, because protein breakdown product is uric acid. There are three joints that are commonly affected. This is first metatarsobopharyngeal joint. So pharyngeal joints are affected, mid-tarsal joints, and the knee is affected. Now, unfortunately, there is not picture, so I will Google it. I want you to show the picture. You see, this is how it looks like. But I guess this one is better. So this is much more visible. So crystals, excessive amount of uric acid crystals are accumulated. Then inflammation starts because of these crystals, and all the signs of inflammation is found: dolor, so edema, redness, and so on. So I already mentioned all of them. Here, this picture is also really good. So you see uric acid crystals in tofu. So tofu, yeah. Okay. This is very important to know the mechanism pathogenesis. So here they are talking that gout is more common among the men than women, and affects mainly after the age of 30. In women, it tends to occur usually after menopause. You know what menopause is. There are number of predisposing factors. For example, so we know pathogenesis, so mainly because of the food rich of protein, but that's not enough only, because some people may eat lots of protein, they may don't develop gout. They should have predisposing factors also at the same time. So those predisposing factor is family history. So if you have close relatives with this disease, you may have the chance to develop gout. Obesity. Obesity is actually the risk factor almost all the disease. Excessive alcohol intake. Exactly, yeah. High purine diet. Purines are found in many foods: meat, game, and seafood. Yeah, actually, here even they so so here they mention the high purine diet. The purines are found in meat and proteins.
But isn't like the proteins make
Sorry.
it like better? Isn't like the proteins make this
Yeah, yeah,
better? Yeah.
yeah. So not really, but um, uh, uric acids are the so here this sentence is really good. Uric acid is a base product formed from the breakdown of food and protein in the blood and tissue. The crystals formed after supersaturation of the tissues are needle-like and cause inflammation and swelling, painful swelling of the joints. But yeah, we can say directly that it causes, or only this causes, this is one causes, but this is a mechanism. We don't know. I mean, this is the mechanism actually. If the patient have the gout, those uric acids are produced from protein or different food, but mainly proteins. Yeah. Okay. If they have disorder. Acute infection can be the risk factor. Use of diuretics. This is very important risk factor. For example, for me, because from my clinical practice in cardiology hospital, we have lots of patients, because of heart failure, we are prescribing them diuretics. So very common side effect is exacerbation of gout, so it's important. Ketosis, surgery can be risk factor, leukemia, and actually chemotherapy treatment of leukemia, I guess, because of this treatment, lots of cells are break down, lots of purines, lots of DNA and RNA are break down, and they also containing the products which have opportunities and possibility to be break down in the uric acid, which are the sources of the crystals. Okay, cytotoxic drugs, yeah. Hypertension. It's really interesting how hypertension can be. Actually, hypertension is also a predisposing factor for many diseases. And renal failure. Okay, this is an important thing. So you should know who are the increased risk of development of gout. So diagnosis: the person may experience intermittent episodes of acute joint pain. This is characteristic sign, and sometimes they can't stand this pain. The pain may be so great that the patient is unable to tolerate the weight of bed clothes. Can you imagine? So they have very devastating pain. I guess the main diagnosing factor is history-taking, examination, and investigation to check concentration of uric acid in blood, urea concentration in blood. Yeah, that's a main diagnostic factor, as I see, as I know. So care and management. How can we manage those patients? First of all, as I told you, the main symptom is pain. So we should manage the pain. Lifestyle modification, because as we already see there, lots of risk factors. They are the modified risk factors. For example, obesity, we should encourage them to lose the weight, and lowering of urate levels. So this is the cure and management. Pain relief can be achieved by the different pain reliefs in NSAIDs, but I'm not going through this. So pain relief, it can be achieved by NSAIDs. Lifestyle modification, I'm not talking. There are other medications, this is important. For example, allopurinol, which is not for acute phase of the gout. This is important because gout is a chronic disorder, but they don't always have the symptoms. So sometimes, so maybe there will be some period, several months or even years, I guess, when the patient doesn't have any symptom, but because of the different risk factors, symptoms can be exacerbated, and so there will be recidiving. To prevent acute gout, acute symptoms, doctors are prescribing allopurinol. Allopurinol is the medication which blocks the production of uric acid. Therefore, main pathogenesis pathway is blocked. So keep your mind, because this is important. NSAIDs, non-steroidal anti-inflammatory drugs, this is for acute gout, but for the management, for the long period management, we should prescribe allopurinol. Yeah. Okay, here we have the case. I hope everything was clear for you, man, Abed?
Yeah, it is. Yeah.
Okay. So, could you please read the case if it's okay for
Yeah.
you? Okay.
So James Siegel is.
Sorry.
Oh, wait, okay. So case study. James Siegel is a 62 year old man who present at his JB's surgery.
General practitioner.
Mhm.
General
Com-
practitioner surgery.
okay, complaining of pain and swelling over his left great toe at the metatarsal uh, phalangeal joint.
Yeah.
When Mr. Siegel's foot is examined by the practice nurse, Stella Brent, she finds the great toe is erythematous, okay, warm, swollen, and tender to touch. What does it mean? The
Erythematose.
Yeah.
Erythematose, that means that there is a redness. Erythema, that means the redness changing color. Yeah, redness.
Mhm. Okay. So redness, and he has had at least 3 other episodes of this type of pain, lasting for about 2 or 3 days. But he tells nurse Brent that the pain is now worse, and he has had it for 6 days. During the examination, nurse Brent also noticed a small rounded uh, sub- subcutaneous noodle. Um, which is tender and rubbery to the touch. Okay, the patient has a history of type 2 diabetes, mellitus controlled by diet, and hypertension controlled by hydrochlorothiazide. I don't know what is that. Okay.
Hydrochlorothiazide. This is the type of diuretics, thiazide diuretics.
Mhm.
Yeah, which is mainly prescribed for the hypertension, but yeah, because
Okay.
yeah, but there are
Okay.
many other drugs for the hypertension, of course. Yeah.
Got it. Tentative diagnosis of gout is made. Yeah, so they made the diagnosis.
Yeah, they made diagnosis. Yeah, thank you, Abed. This was really good case. Actually, so everything was mentioned here. Left, so great toe. So this great toe is the most common site of development of gout. So keep your mind. This is important. So symptoms was the pain lasting 2 3 days, recurrent pain, right? There was small rounded and there was other symptoms also, erythematose, warm, small and tender to touch. All these symptoms are the symptoms of inflammation. Yeah, any inflammation causes erythematose, and warm, swollen, tender. This is a sign of inflammations. She found out that the subcutaneous nodule, which is tender and rubbery to touch. Yeah, and the patient has a diabetes 2 and hypertension. We know that hypertension is a risk factor. Okay, the signs. So actually, the vital signs: temperature was increased. Okay, heart rate 88, respiration 14, blood pressure was increased. Just okay, go to saturation. Uh, So yeah, so they joint fluid test. They found urate crystals. Serum uric acid concentration was increased. It was 9 milligram per deciliter. You see the normal range is this. Creatinine concentration was normal, but it was in high normal range. Okay, take some time to reflect on this case and then consider the following. What information from the patient's subjective history may be required? Subjective history. Maybe I will ask maybe about her diet, what she was, or and yeah, what he was eating mainly. Maybe about body mass index, family history, I don't know. Why might joint fluid be taken from the affected joint, and what might this reveal?
Like
Um, yeah, okay.
the how much there's uric acid in it, so
Yeah,
the concentration, yeah.
exactly, man. Yeah, uric acid crystals. Yeah, yeah. We did not mention this, but it was written there as a diagnostic tool. Yeah, taking the joint fluid. Yeah. Okay, man. So next question: what treatment might be required in order to help Mr. Segal with this condition? So we mentioned this. What will you tell?
So he said that he's having an episodes of like pain, so we should give him some uh, anti-inflammatory, uh, steroidal drugs, and
Yeah,
maybe like pain management for the pain, and for the condition we should give him that the drug you mentioned, albo something,
allopurinol.
albopurinol. Yeah, yeah. So yeah,
Well done, well done. You, yeah, okay, yeah,
I think
good.
maybe change his diet also.
Yeah, yeah, I guess, yeah. Are there any health promotion activities the nurse might wish to discuss with Mr. Segal? Actually, yeah, we mentioned, but what can you tell? What will you encourage him? But actually, we mentioned them.
Like yeah, like better diet and maybe exercise, and yeah, I think that
Yeah, weight loss, alcohol. I mean, cessation of the alcohol intake. Also, cigarette smoking is bad generally, but mm, we can't say directly it affects the gout development, but
maybe the hypertension also.
hypertension, yeah, control hypertension, yeah. So hypertension, alcohol intake, diet, loss of weight, yeah. If he is obese. Okay, man. Thanks, Dan. So we know now how we should assess the patient with gout and what kind of recommendation should we have. Okay. Okay. Now another very important disorder, quite common disorder actually. Sorry, what's this? Quite common disorder. Low back pain. Have you ever had back pain, man?
Like in the lumbar area.
I guess, yeah.
I guess yeah, I did.
Yeah, I guess almost everybody. I don't know anybody who has never had low back pain. So, but there are different kinds of back pain, low back pain, and different reasons, and severity is different. So, low back pain is a leading cause of disability, can interfere with quality of life, and is the most common reason for medical consultations and work absence. Can you imagine, man? So it's most common reason, I guess, in UK, because this book is written by you in UK. So reason for medical consultations and work absence. Low back pain can be caused by number of reasons, the majority of which are non-serious. So majority of the reasons are non-serious and can be displayed in a variety of different ways. Non-specific low back pain can be seen as tension, soreness, and or stiffness in lower back area between the bottom of the rib cage and the buttock crease without specific cause of pain. Several structures in the surrounding area may be contribute to the pain, including joints, muscles, ligaments, discs. The patient can also have a loss of lower limb reflexes. This is known as a radiculopathy, and this pain generally results from spinal nerve root compression. This is commonly caused by herniated. Okay, so I read all the text because this is very important. So there are different reasons. Majority of the reasons are not serious, um, but itself the low back pain, the most common reason of the medical consultation and work absence. So This makes this disorder very interesting and important. Here we have one of the very serious and important cause of low back pain. This is called cauda equina syndrome. Uh, um, okay, can you read, please,
Yeah, of
Sabit?
course.
Okay.
So cauda equina syndrome. This is a serious neurological condition where there is damage to the cauda equina, a bundle of spinal nerves and nerve roots from the bottom of the spinal column, and subsequent loss of function in the lumbar nerve roots. Patients may report severe back pain, saddle anesthesia, or para, paresthesia. Okay,
Paresthesia.
which
Paresthesia,
means
this is
yeah,
pins and yeah,
which is pins and needles or numbness.
yeah,
Okay, in the groin or inner thigh region, bladder and bowel dysfunction, um, gait dystrophy,
disturbances.
yeah,
You know
and
what
weak.
does it mean? Yeah,
Yeah, so
of
it's
course.
yeah,
Yeah.
and weakness in the lower limbs. Diagnosis initially by examination of MRI or CT scan. Management frequently includes surgical decompression as quickly as possible to relieve the pressure on the nerves. Okay.
Yeah. Thanks, man. Thanks, man. So I guess this disorder, cardiac, is the most serious causes of the low back pain, and it needs actually mediating medical intervention. Okay, now let's go to the risk factors for the low back pain. So age between 35 55 years, sedentary lifestyle, obesity, the obesity is poor postures, arthritis, osteoporosis, lack of exercise, occupation. So, different occupation may increase the risk of development of back pain. So, how low back pain is diagnosed? Yes, somebody join us. Okay, Solomon, hello. How are you, man? Solomon, can you hear? Okay. Okay, man. Hello. Yeah. How are you? Okay, man. Good. So we have final tutorial today. Last tutorial. As you remember, it's okay, man. It's okay. It's okay. Uh, as you remember from the previous tutorial, we did not finish uh, first. We did not finish musculoskeletal chapter. So I'm going to finish it, and then a few and I will discuss also a few disorders from the skin chapter and electrolyte and fluid disturbance chapter. And I have also prepared questions to assess your knowledge about musculoskeletal system. And if you have time left, I am ready to do some activities with you to assess your knowledge, how well you are prepared for second midterm. So if you have time, we can do the activity to assess your knowledge about previous chapters. Okay, so now let's continue. I was talking about and we was discussing low back pain. We discussed one disorder, gout. I hope you will read about it. I don't think it's very difficult, so you will read it later for sure. Now we are talking about low back pain. I'm sure we was talking about that. We mentioned that is one of the most common reason of medical consultation and sorry, what's this? One of the most common reason of medical consultation and work absence is low back pain, and there are different reasons. Majority of the reasons of low back pain is not serious, but some of them is very serious. For example, serious neurological condition, Cauda-Equina syndrome, which is where there's damage to the Cauda-Equina, band of spinal nerves and nerve roots from the bottom of the spinal column, and subsequent loss of function. So this disorder is a serious reason of the low back pain, and it needs medical intervention as quick as possible. Now we was talking about risk factors, so age, sedentary lifestyle, obesity, poor postures, arthritis, osteoporosis, lack of exercise, and occupation. A specific uh, workplace or I don't know, specific occupation can be the risk factor. So diagnosis, how we can diagnose low back pain. Acute non-specific low back pain is usually classed as 6 weeks or less, and this type of low back pain usually resolves with over-the-counter painkillers. So with painkillers and X-ray or other forms of investigations are not indicated. So acute non-specific low back pain should be uh, treated just with painkillers. We even don't need X-ray. For patients whose non-specific low back pain continues for longer than 6 weeks, they should be regularly reassessed, usually by physiotherapists. X-ray is of no benefit, and MRI is indicated if other specific so X-ray is of no benefit. MRI is indicated if other specific causes low back pain are suspected. For example, herniated disc, cauda equina, fracture, malignancy, inflammatory disorder within the context of surgical referral. Care and management. Yep, so appropriate management is needed. Should provide advice and education to promote self-management, give the information about risk factors, exercise programs, but those programs should be adequate. Yeah, manual therapy, acupuncture can be helpful because we knew that no pharmacological example manufacture for the pain relief. Exercise should consist of aerobic activity, mass strengthening, postural control. For those patients who have high degree of psychological stress and disability, it's very interesting for me. So psychological stress and the disability recommendations are to combine physical and psychological treatment programs, because psychological distress, so stressful situations, can be the risk factor of the low back pain. Non-specific, there should include exercise and also cognitive behavioral approaches to manage long-term non-specific low back pain. Not everybody who had the pain or even acute pain needed the psychological interventions, or I don't know. I think, but relaxation, general relaxation, and having, I don't know, yeah, will be good. But for the long term, if it lasts years, I guess they may need some kind of, and if it's connected to the psychological stress. Okay, enhancing comfort. Red flag. We have the red flag here. Abid, please, you are, if you can read this red flag for us.
So it says enhancing comfort when
Okay.
caring for uh, orthopedic trauma patients. Comfort is paramount for high quality care and positive health outcomes. This vital element of care may be more complex for the trauma patient because of the nature of their condition, injury or surgery. Okay, injury or surgery. Okay, got it. Muscle skeletal ins- instability and movement may cause the patient significant pain and discomfort. healthcare provider should be competent in okay pain and comfort assessment, pain and comfort management, and moving and handling. Okay.
Yeah, yeah, it's very, very general red flag, but it is really important, really important. Yeah, and we have another case. I guess Solomon, you can't talk here because you right. So I will ask Abed also to read the case. Sorry. So Abed, please, if it's okay for you, I, if not, I
I
can.
mean, I'm a bit tired because I had a final today, but yeah,
Okay, okay, man. Okay, so
I may make mistakes while reading, but yeah.
I got it. I got it. I will read this case, then we will have a break, and then uh, we will continue. So I will read this. By the way, which subject did you have the final
I had it in the communication skills.
communication skills? Okay, okay. Who is your lecturer for
I
this
think
subject?
it's called Professor Ia.
Yeah, Zedilashvili. Okay,
Yeah, I don't know the last name, but yeah.
okay, okay, man. Okay, Abed. So I will read this case, and so we have the patient Emma Brown, who is a 32-year-old primary school teacher. She lives with her husband Mike, and they have two small children aged 10 and 8. Emma has had low back pain for 3 months, which has recently got much worse. She cannot sleep at night due to pain becoming so intense, despite the general practitioner prescribing painkillers and anti-inflammatory drugs. So, despite she is taking painkillers, anti-inflammatory drugs, she can't stand with this pain, especially night. She has now been off work for 1 month. So, as we already mentioned, this is one of the most common reason of the work absence for once, and is struggling to do her personal activity of daily livings. So you can imagine how painful is it. She has an antalgic gait pattern and is feeling very depressed about the whole situation. Emma has been referred to see a physiotherapist. Okay, very interesting case, and you can see how debilitating, how stressful, and how severe it could be low back pain in some cases. Okay, so take some time to reflect on this case and then consider the following. What do you think the diagnosis might be? Might there be any other possible diagnosis? Is there a differential diagnosis? Uh, what do you think? Uh, generally there is low back pain, yeah, they already mentioned, but they should assess and they should uh, knew the exact mechanism, exact reason, because there are many reasons, right?
Yeah,
Uh,
so maybe they should take like more informations from
yeah,
her and make like other examinations and checks. Yeah.
exactly. Maybe she will be required to do the magnitude MRI, yeah, or CT scan. Yeah. Okay. What test? Okay. What test and investigation might be GP request in order to make the diagnosis? So we mentioned maybe CT, MRI. Uh, I think that those will be very important. Yeah. How would you explain that what non-specific low back pain is to Emma? Non-specific low back pain. Uh,
I mean, maybe we can say that to her that she have been like stressing herself, especially putting pressure on that area, I
yeah.
guess.
Mhm. Okay. So yeah, mm, yeah. Maybe we'll just give her the general information. I don't know. Yeah, generally, because education and knowing what this condition means generally, it's very important. Actually, this is very important part when it comes to the give the information to patient, because we spoke about it a lot during previous chapters, and in this book they emphasize and they pay too much attention to it. It's very important. So patients should always be informed about her here or him diagnosis, about the procedure. Right now, for example, I have the module in arrhythmology, in rhythmology. This is branch of cardiology which is mainly specialized and specified the arrhythmias, right? Rhythm disturbances, and there are specific cardiological doctors who are called arrhythmologists who mainly cure the arrhythmias, and they do also mini operations, for example, ICD implantation, electrophysiological study, and ablation, for example, if there is a specific arrhythmia which can be treated with ablation. So, the way I mentioned, I really like who is my mentor now. I really like the approach, his approach, because during procedure, during intervention, he always have the communication with the patient. Patients are alive during alive, not they don't have the general anesthesia, so they have the communication and he always explains every procedure, everything. She tells him that you may feel now you may feel now pain because of the needle insertion. You may feel now some sensation or something. We are doing this now. We are doing this. So always communication. This is a really good approach, and actually, I mean, this is a correct approach because this decreases the anxiety. I mean, and I guess the outcome is much better when you have the communication and when the patient know everything during intervention, and also before the intervention they should know about the risk factors, about the risks, about the outcome. Yeah, okay, that's what I wanted to tell you. Because and as a nurses or rehabilitation workers, doctors, this is also how it works. Yeah, yeah, yeah. I prefer to know, as a patient, I prefer to know how many percentages, um, for example, risk factors. uh, yeah, and I prefer to know what they are doing now also, because I feel more safe. Okay. Okay, let's continue, guys, and we will have the break soon. Let's finish this, and we'll have break. Actually, we finished. This was a final case here. Yeah. So actually, let's have a break now, guys. 10 minutes break. Then we will be back. Then I have prepared several. Cases, several multiple MCQ questions and true or false questions about muscle skeletal system. Then after those questions, uh, we can discuss the disease of skin and the fluid and electrolyte. Yes, we will continue. We will continue at 18 5. Okay, my students, I am back. Are you also here online? Abid, Solomon, are you here? Okay, Solomon is here. Let's wait for the Abid. Okay, Abid is also here. Okay, guys. Okay, so as I already mentioned, um, um, so we are gonna to um, go through the questions about musculoskeletal system now, and then briefly disorders associated with fluid and electrolytes, and also skin disorder. Okay, let's start. Okay, here we have. Okay, so babies are born with 300 bones in their bodies. When they reach adulthood, this number is 320, 299, 196, 206. Actually, we mentioned this previous tutorial. I definitely remember because I did not remember the number and I checked. So what do you remember? What do you remember, guys? How many bones are
Uh,
found?
we both answered D, so 206.
Yeah, okay, yeah. True, that's true. True, yeah. We of course. Yeah, of course 206. So next question. The largest bone in the human body is. Hmm, I'm not sure if we mentioned this, but this is an interesting question. Clavicle, ulna, femur, or tibia? What do you think? Or what do you know? You can search actually. Now here it's okay. But
I actually took anatomy last semester, so
yeah,
those are not that hard. I think it's C, femur.
yeah, okay. So more about human. Okay, yeah, that's true. That's definitely true. It's fem. Okay, well done, you guys. So next one. What's the smallest bone in the human body? Mandible, radius, sternum, or stirrup? Okay, what do you think?
I think it's A.
A, mandible. Okay. Some more about you. Solomon thinks C or A. Ah, A also thinks A. Okay. Actually, so 1 minute. Correct answer. Correct answer is I don't know how to pronounce correctly. Stirrup. I will show you now. Mm, Stirrup bone. Ah, this is the bone inside of ear. You see, smallest bone. Yeah, yeah. In Georgia, we call it. How is it in Georgia? So you remember the inside of bone there we have inside of ear we have three bones, yeah. uh, Stapes, ingus. So okay, I guess you got it, yeah. Here is it, yeah. Hammer, anvil, Stirrup. It's very tiny. Okay. Okay, sorry. There's three, but they are connected to each other, and they are separately individual bones also. Yeah. Okay, let's continue. So joint that allows free movement is known diarthrosis, hemarthrosis, synarthrosis, or amphiarthrosis. What do you think, guys? Or what do you know about? Diarthrosis, hemarthrosis, synarthrosis, amphiarthrosis. Abed, I did not get it. What do you mean? I will make sure to.
To check it. So I
Okay.
say D. Yeah,
Which one?
I think it's D. It's like circular, like the shoulder. But I gotta make sure.
Amphiarthrosis. Mhm. Okay, Solomon, what about you? I think it's between C and D. Okay, C and D. Okay. Actually, correct answer for this case is A. Diarthrosis. So hemarthrosis is, of course, blood inside of our joint. Amphiarthrosis. So more free movements allows diarthrosis. I guess you just have to remember this. I don't know how to explain. Yeah. Actually, what's the explanation, exact explanation? Synarthrosis and amphiarthrosis. I'll check. What did you search, synarth? So synarthrosis is a joint that is essentially immobile. So synarthrosis is immobile. Amphiarthrosis, amphi is a joint that has limited mobility. So the arthrosis is exactly the correct answer. I hope you understand. So fifth question, number 5. When electrical activity occurs in the muscle, this causes thin actin containing filaments. So when the electrical activity occurs, this causes thin actin filaments to lengthen, shorten, stay the same, rupture. What do you think?
So I think it's B. Shorten to like compress the muscle.
Okay, man. So what do you think, man? Because of exam, yeah, but okay. Yeah. Yeah. What time is it now in Israel?
So it's there is a 1 hour difference between Israel and Georgia. So yeah, it's 5 p.m.
Okay. Okay, man. Salman, what do you think, man? What's this? What's the correct answer for this question? Solomon does not conduct, but I think this is a very easy question, and definitely B is correct answer. I hope Solomon will understand also. B, of course, man, of course. Yeah. Shorten because the electric activity it's shorts and there's movement, I guess. Yeah. B, 6. When the actin-rich stimulus is removed, the result is relaxation of the muscle, contraction of the muscle, no change in mass, rupture of the muscle. What do you think, guys? What came? I think it's easy also.
So I think it will be relaxed. So yeah, A.
Okay, man. So what do you think? Someone thinks B? No, not B. This is previous questions B. I think this question is very easy also. Yeah, A is correct answer, and I hope Solomon you understand also. Because if the stimulus is removed, relaxation develops. A. Yeah, I hope Solomon you understand also. The next question: the area in the brain that houses the major voluntary motor area is called right central gyrus, medulla oblongata, the midbrain, the cerebral cortex. I don't remember. I don't know if we talked. I don't remember actually. Maybe we talked about it. But is this important? So what do you know and what do you remember, guys?
So I think it's the medulla oblongata. So B.
B. Why? Do you remember this one?
I think yeah, I was confused between it and the midbrain.
Mm-hmm.
Uh, but yeah, I'm pretty sure it's B.
Okay. So what do you think? Solomon? Or you prefer to tell you the correct answer? Okay, I will tell you correct answer. Actually, correct answer is D, cerebral cortex. I guess this is very general answer because others, medulla oblongata, midbrain, central gyrus, are not half a major voluntary motor. Voluntary motor areas. So there's cerebral cortex, and there we have the. Yeah, I don't know how to explain, but others are not definitely for the voluntary movements. Yeah, I guess this is also you have to remember. Yeah. Okay, this question is easy. Next one. Opiates are antibiotics, antifungal, strong analgesics, antiplatelets. I'm sure that you know a good answer for this, though. Of course, it's strong analgesics. I know you both know about opiates are strong analgesics. Yeah, because we spoke lots about it. Someone your answers are you think about the ATS strong analgesic. Yeah, this is true. Abed, I'm sure that you knew the answer. Yeah. I'm sure Abed you knew also the answer. Uh, Now number 9. How long can the effect of plasmapheresis be expected to last patient with myasthenia gravis? Um, we did not spoke about myasthenia gravis, and we did not spoke about this, so I will tell you correct answer. Myasthenia gravis is a disorder of the muscle disorder because of acetylcholine concentration is decreased in the nerve synapse. and the plasmapheresis can be the treatment. This is very, very specific information. How long can be affect plasmapheresis for the myasthenia gravis? Correct answer is 6. So this question, I mean, you will not have, I mean, because we did not discuss this. So the most common test used to confirm diagnosis in myasthenia gravis, same thing, because this is myasthenia gravis. Actually, myasthenia gravis, there was not cases about the myasthenia gravis in your book when we did not discuss. So it's my fault that I include this question. So, but I will tell you anyway. The myasthenia gravis, this is muscle disorder. Acetylcholine concentration is the problem is acetyl concentration, and the diagnosis for myasthenia gravis is Tenzilon test. Tenzilon test. Remember this. Okay, guys. Now about true or false questions. True or false questions. Just do few questions, and then I don't want this question. Okay, and what's this one also? This one. Fracture is another word for suture. So such suture. I don't know. Is it true, guys, or false?
I don't know actually, but I think it's false.
It's false. It's false, of course, because they are different terms. Fracture is different. Suture is different. Yeah, Solomon.
Yeah,
I hope.
like after the procedure, you like
Yeah,
yeah. Okay, yeah. I
fracture
get
is different. Yeah. Okay. It's like sewing. Yeah. Yeah. Okay. So it's false, of course. Carpal bones are found in the feet. Is it true or false? Carpal bones are found in feet.
in feet. I think it's called tarsals, not carpals. So
Yeah,
carpal
carpal
in
bones
the
are
hand.
found
Yeah.
in the
So
wrist.
yeah, false.
It's false. Yeah, false. I hope Solomon you knew also about it. Carpal bones. Yeah. So you mentioned false. Yeah. Symptoms in the arms can arise from problems in the neck. Is it possible? Is it true or false?
I mean, I don't know if there is any like nerve connected between them, but from I don't know, from a muscle wise, I don't think so.
Okay. Solomon, what do you think? It's possible. Yeah, man, Abed, yeah. It's maybe not about the muscle, but because of nerve, yeah. Because of nerve transmission, it's possible, yeah. Okay, so it's true. Knee joint is one of the most flexible joint. It's false, actually. It's not the most flexible joint. Okay. Okay, next question. Non-steroidal anti-inflammatory medicines are safe to use and have no side effects. Is it true that
But
NSA? Yeah.
you can vomit or have nausea or diarrhea, I guess. So
And one of the most common problem is GI tract problems. Yeah, for example, gastritis or pain. Yeah. So yes, Solomon, I am sure that you remember because we spoke lots of about NSAIDs and the side effects of NSAIDs, and we spoke that the NSAIDs inhibiting prostaglandins production also in gastric, in stomach, and those prostaglandins are important for the protection of the stomach surface. So if the prostaglandins concentration is decreased, there will be increased chance of development of gastric ulcer, gastric problems, gastric pain. So they have lots of, they have the side effects for sure. So it's false that they don't have. Healing is especially, we don't need this. Tendons and ligaments are composed of cholesterol. Is it true or false? Are the does the cholesterol make tendons and ligaments?
I don't think so. Or maybe there is some cholesterol in the component, but I don't think they make the tendons and ligaments themselves. So no.
Okay, Abid. Salma, what do you think? You think it's true that cholesterol makes tendon and ligaments? Yeah, they may contain. Yeah, they don't make. Yeah. So they don't make. They may contain. So this sentence is false, because of course cholesterol does not make. There will be maybe accumulation. Yeah. Okay, guys. This was about question for assessment your knowledge about musculoskeletal disorder. Now, yeah, this is last lecture, but yeah. But now we have to go through the fluid and electrolyte balance and associated disorders. But just I will speak just about the main disorders, just few words, because we don't have that much time now. And I will tell you, and those so yeah, let's start. So first topic is nausea and vomiting. There are many reasons for the person may feel nauseousness and vomit. Most people will experience nausea or vomiting during a disease process. This may be as a result of the disease pathology or consequence of treatment. Yeah, so it can be quite common. Nausea is an unpleasant sensation of imminent vomiting of the stomach contents through the mouth. The sensation produces a feeling of discomfort in the region of the stomach with a feeling of need to vomit. Nausea can be short-lived or long-lasting. A person may experience nausea alone with no vomiting, or they may vomit without any feeling of nausea beforehand. Some people experience nausea and then go on to vomit. Nausea, therefore, does not always lead to vomiting. So, usually, the presence of nausea means that there may be underlying pathologic condition occurring in the body. Following can be diabetes mellitus, influenza, gastroenteritis, renal failure, adrenal insufficiency, peptic ulcer, vertigo. I'm sure you both have, and I also have this feeling now, as everybody has. Treatment depends on the causes, of course. Healthcare professional may advise patients to eat small meals throughout the day as opposed to three large meals, and encourage the patient to eat slowly, avoiding foods that are hard to digest. It's if it's the smell of food that's provoking the nausea, then foods should be eaten. Am I spelling correctly? Is it spelled nausea or nausea? I don't know. Guys, do you know how to spell this word correctly, nausea? I don't think I'm spelling correctly. But not spelling, but my pronunciation, or am I saying it correctly, nausea, or okay, it's correct, nausea. The food should be eaten cold or room temperature, avoiding the smell of cooked food or food that is cooking. And there are, of course, drugs, antiemetic drugs. First of all, metoclopramide, and this is important because the nurses or the rehabilitation doctor, as a healthcare professional, So you always have this patient with this symptom, nausea. And this is universal drug, metoclopramide, and all the nurses, all the healthcare professionals know about it. So when the patient have the nausea, metoclopramide. Medicine that is given to prevent or stop nausea and vomiting may also be administered. There are also a number of mechanical aids that are used to help prevent nausea. This device works by applying continuous pressure on specific acupressure point located on the wrist and can be used by children and adults. Now about vomiting. Vomiting is a complex physiological activity. It can be defined as the forceful explosion of the gastric contents through the mouth and or nose. Excessive vomiting can have a profound effect on a person's fluid and electrolyte balance because, yeah, so why they are discussing those topics in fluid and electrolyte chapter, because vomiting can be the reason of the electrical disturbances. Sometimes also, so vomiting situated in the medulla oblongata. You mentioned today about the medulla oblongata. This was in our case, and they have also mentioned in the medulla oblongata is the site of the vomiting center in the brain responsible for initiating vomiting. Reasons for the vomiting can be fear, anxiety, odors, pain, unpleasant sights, side effects of some drugs. I remember myself when I had some mini surgery, actually surgery. I was prescribed to take antifungal drug to prevent fungal development, and those drugs was, so I had the nausea and actually I vomiting. So because of those drugs, I now it was years ago, and I even remember now it was radiotherapy. Sorry, sorry for this. Radiotherapy and hypercalcemia also can cause vomiting. The sensitivity of vomiting center varies in different people, and as such, the healthcare professional should treat each person on an individual basis. So it's important to determine, if possible, the cause of vomiting. Removal of the causative factors, if possible, should be first line of treatment. So you should treat and you should remove the reason. Yeah, caring for the patient who is vomiting will include the following: wash hands. Ask the patient if they have any tried and tested method of dealing with vomiting. If we appropriately implement this. Ensure the patient is carried for an upright. Care for the patient in a lateral position if they are unconscious. Administer prescribed antiemetic medication. Ensure privacy. Curtains are drawn and doors closed because it's inappropriate. Yeah. Provide easy access to vomit bowel and tissues. Remove the dirty vomit bowel and replace with a clean one as soon as possible. Offer the patient physical comfort by being with them and holding the vomit bowl or mopping their brow. Observe, measure, record, and report vomitus. Provide the patient with opportunity to use a mouthwash. Provide the patient with the opportunity to freshen up after they have finished vomiting. Change and dispose any solid clothing, bedding using local polythene procedure. Wash hands. Try to avoid strong odors such as food, perfumes, and aftershaves that may induce nausea and vomiting. So this is important as a. So we have case here now. Okay, I'll go through this case. What time is it? No, let's go. Yeah. Okay, so now let's go to this case. So we have Teija Kovalainen is a 64-old lady who works as a clerk in bank. Sorry. So in clerk in bank in City of London. She lives at home in flat on the 8th floor with her husband and her recently divorced daughter Rita. She was a fully independent lady with no significant past medical history. Both her parents died about 20 years ago. Her father had a myocardial infarction, and her mother died as a result of cancer of the stomach. Tejo was admitted to the emergency. The A stands for uh, E stands for emergency, and A stands for, oh my god, uh, emergency, and I have to search because I can't. But I searched it before. Emergency, sorry.
I think it's accident and emergency.
Yeah, it's accident. Yeah. um, yeah, it's accident. Yeah. Oh, it's accident. Yeah, sorry. Okay, it's my fault. I don't know what I. Okay, okay, sorry. Because I did not knew the ACE what stands for. I searched about it and I was thinking why I don't remember. Teja was admitted to the emergency department. Teja's daughter Rita heard her call for her help from the bathroom, and Teja was found on the floor, pale and sweating. In the toilet bowl, Rita noted a foul, smelly black-like diarrhea, as well as some blood, and she called for an ambulance. Teja was recently diagnosed with gastroenteritis and was prescribed antibiotics and antiemetic by her GP, and she purchased an antidiarrheal medication over the counter at the pharmacy 3 weeks ago. Previously, Teja had been experiencing excruciating abdominal pain. Excruciating. She had lost some weight and was having bloody diarrhea, stools 4 or 5 times a day. She was becoming increasingly tired at work, was having alternating constipation and diarrhea, and she did not share these issues with anyone. Okay. Okay. So, Teja, 64-year-old woman, clerks in London. She lives, she department is fully independent in medical history. 20 years ago, her father had myocardial infarction, mother died because of stomach cancer. Teja admitted a department. Teja's daughter Rita heard her call from the bathroom. Teja was on the floor, pale and sweating. The toilet bowl Rita noted a foul, smelly black-like diarrhea, as well as some blood, and she called for an ambulance. Teja was recently diagnosed with gastroenteritis and was prescribed antibiotics and antiemetic by her GP, and she purchased an antidiarrheal medication over the counter at the pharmacy 3 weeks ago. Previously, Teja had been experiencing excruciating abdominal pain. She had lost some weight and was having bloody diarrhea stool 4 or 5 times a day. She was becoming increasingly tired, blah, blah, blah. Okay, the paramedics assessed and transferred Mrs. Kova client to the department, and intravenous infusion was in situ with 1 liter sodium chloride in progress and 100% oxygen via face mask. So sodium chloride infusion and oxygen face mask. On examination, she was sleepy but rose-able. She looked pale and her extremities were cold. Tejo reported central abdominal pain. She was feeling nauseous. Yeah. Reflect on this case study and think about the following. With regards to the care of Mrs. Kovalin, what are her immediate needs? Yeah, what do you think? What's her immediate needs?
I mean, it says in the case that she's taking like pills for diarrhea.
Okay.
I think and it says that I think she needs some liquid, like first of all, because of the diarrhea.
Exactly, man. Yeah, because of diarrhea, because of losing lots of fluid and also electrolytes. And I guess, and she received 1 liter sodium chloride. Yeah.
Yeah,
So,
she did.
so this is the first line treatment. So she needs liquid with electrolytes and oxygen, of course. Yeah. Thanks. So, what indicators may suggest that she's dehydrated, and what would be the safest, most effective method of correcting her dehydration? So, dehydrated. So, how can we guess that he's dehydrated? She is dehydrated. If you remember, unfortunately, we didn't have time and we did not discuss all these mechanisms of dehydration. We just, do you know how can we make the dehydration? For example, as in cardiology, also it's very important. She's pale, yeah, yeah. Which you should look also the eye, how the eye looks like. Is it dropped inside it? We always also in cardiology department, if we want to assess if the patient took enough amount of water, we always ask to show us the tongue. Show us the tongue, and if his tongue is um, liquid, I don't know, it means that patient drink lots of water and this water is everywhere in but if the tongue is uh, I don't know how to explain it. I guess you wet, yeah, wet and dry. Exactly. This is the correct word. Yeah, if it's wet, it means that patient, yeah, generally drinks. Yeah, and also the yeah. Okay, no, thanks, Ab. Okay, how can you help meet Mrs. Kovalian's emotional psychological needs? How can you help meet the Mrs. Kovalian's emotional psychological needs?
I mean, like psychological, like support, like someone should keep like next to her and take care of her, like lower the anxiety because it does affect a lot. And yeah,
Exactly, man. Yeah, yeah. And of course, we should provide the privacy and use the cartons because, yeah, and speak. Yeah, I don't know. Yeah, yeah, but okay, antidiarrheals, medicine management. Okay, I will read this. So sometimes these medicines are called anti-motility medicines and bulk forming agents. They are used to treat acute diarrhea. They include codeine phosphate, codeine, cofenotrop, and loperamide. Yeah, one of the most common one is loperamide. The most commonly used anti-motility medicine, yes, they mentioned this, loperamide. So anti-vomiting and anti-nausea was metoclopramide, anti-diarrheal loperamide. This medication can be purchased from the local pharmacy or on prescription from a registered prescriber. Most people only need to take these medicines for a few days. Antimotility medicines are used for the treatment of acute diarrhea, and they work by slowing down the movement of the gut. This reduces the speed at which fecal matter uh, passes through. So, as food remains in the gut for longer, this allows more water to be absorbed back into the body. This results in firmer stools pass less often. Yeah, so low pyramid, keep your mind. Red flag. Anti-motility medicine should not be taken by those who are under 12 years of age if the person has blood or mucus in their fecus and pyrexia. Pyrexia, that means temperature, high temperature. If there is abdominal distension, active ulcerative colitis or antibiotic associated colitis, this type of medication should not be taken. Okay. I guess if you have the blood or mucus in fecus, if you have the blood in the fecus, you directly should call the ambulance and go to hospital. But I don't know why. Okay. Okay, clinical investigation, and they're talking about colonoscopy. What do you know, guys, about colonoscopy?
I think we covered it like before.
Actually, we covered, yeah. Why they remain?
Yeah,
Colon,
so
yeah.
yeah, so they take a tube from the colon to the intestine, and with a small camera and the hole for the air, hole for the liquids. Yeah,
Exactly, and even we watched the video, I guess.
yeah, we did.
Okay, so we can skip it. Thanks, God. Okay. And now, very important topic, caring for the patient with edema, pulmonary edema. Because this is very important, I want you to give you task to search information, 5 minutes, and search information about pulmonary edema. 1 minute. So pulmonary. So 5 minutes. All the information, reasons, causes, treatment, manifestation. Okay, guys? Deal? Okay. Guys, when you will be ready, just inform me. Solomon is ready. Abed, what about you? Solomon, you can.
Yeah, I think I'm ready. I took an idea about it. Yeah.
Okay, Solomon, because you prefer to, you can write down. Abed, if you prefer, you can speak or you can write down in the chat. What did you search, guys?
I just can say it if I can.
Okay, go ahead.
Like I read about it, like edema is like an accumulation of liquids beneath the skin. Yeah, it can happen from like your lifestyle, your shape. So if you're obese, it's more frequent to happen. Sometimes there is like an underlying a health condition behind it, like heart diseases, and like some medicine even can make it happen. And yeah, pretty much there's some advices about like what you should do, your lifestyle, and some medication. I think there's some medications, but
Mhm.
like diuretics. I think I will type it in the chat. And yeah.
Okay, okay, man, okay. Yeah, diuretics. Yeah, diuretics, exactly. Yeah. What about pulmonary edema? So pulmonary edema is a specific type of edema. Yeah? Did you search about it?
I mean, I don't know. I search about the types, like, and I read about like the type is related to the area of the edema itself, and that's it pretty much.
Okay, Abed, okay. Yeah. So more about you, man. Well, what did you search? You can type here. I don't know. You can speak. And we will have break after this.
Okay, I'll
Mm-hmm.
just speak.
Mm-hmm.
So, pulmonary edema is like a condition caused by excess fluid in the lungs.
Mm-hmm.
So, basically, there are like three different categories of types,
So can you speak
and we have
louder
the
because
sudden.
I can't hear you exactly. Okay. Okay, Solomon, speak
Okay,
quite louder. Yeah,
can you
yeah.
now? Okay. So there are three different categories or
Mm-hmm.
types. So there's the sudden, long time, and the high altitude
Mm-hmm.
pulmonary edema. So not like similar symptoms but a little difference in their symptoms.
Mm-hmm.
Like an example, the sudden edema is called the acute one,
Mm-hmm.
and the long term is the chronic one.
Mm-hmm.
So like there's extreme shortness of breath or difficulties in breathing,
Okay.
cold, anxiety, blue tingled lips, and a rapid irregular heartbeat.
Mm-hmm.
For the chronic one, that's where we see the the fatigue, the swelling in the lower extremities.
Mm-hmm.
Like these are one of the major differences in the chronic and the acute one. So
Okay.
um, there's also they also have complications like the lower extremities
Mm-hmm.
and the adrenal swelling in the membranes that surround your lungs. That's the pleural effusion, congestion and swelling of the liver. So there are ways to prevent these things, like especially preventing cardiovascular diseases. Like you can control your blood pressure, watch your blood cholesterol, don't smoke, eat healthy food, limit salt, exercise regularly, and maintain a healthy weight. Also manage stress too.
Yeah. Thanks, Solomon. Yeah, it was difficult to hear clearly all the words, but I heard many of them, and yeah, thank you, and I understand what you mean. Yeah, thank you very much. So pulmonary edema, most the common reason is heart problem, heart failure, especially left ventricular heart failure, and we spoke about it actually when we was talking about heart failure. Abedi was also true about when he was talking generally about edema, but pulmonary edema mainly is because of left ventricular failure when the left ventricles cannot pump the blood to the central circulation. Therefore, blood is accumulated in the lungs. Yeah, and edema develops, and all these symptoms you mentioned. Solomon, then the risk factors, and then the management was true. And let's see what they say here, and then we will have the break. So many patients who are diagnosed with pulmonary edema will be actually ill, and they may be high anxious and afraid. Signs, symptoms, dyspnea, orthoponia, you mentioned about this, wheeze, tachycardia and tachypnea, hypotension, cardiogenic shock, sweating, pallor, cyanosis, nausea, anxiety, dry or productive cough. Investigation, chest X-ray, blood gas analysis, estimation of cardiac enzymes, liver function test, because liver can be affected also because of edema, estimation of urine electrolytes, electrocardiograph. Care and management, reassurance, psychological, psychical, physical support, provides the patient with nurse call bell. We have this actually in hospital. Provide easy access to sputum potent tissues, care for the patient in an upright position, administer prescribed humidified oxygen, administer prescribed medication, strict monitoring of fluid balance, fluid restriction if indicated, monitor, measure, and report oxygen saturation. Assistance will all activate of living as appropriate. Okay, guys. Now we deserve to have a break, guys, and then we can continue. Actually, let's have a 10 minutes break. Yeah, but it was yeah. Okay, let's have a 10 minutes break, and we will continue. At 10. Okay. Sorry guys, I was late. I was scrolling Instagram and I forget about the lecture. I'm sorry. Okay, sorry. Are you here, Abed Solomon? Okay. Actually, this is our last hour through this tutorial, through this course. So let's go let's go through this. Keep this tension. Yeah. So we had the house here with this case study. Okay, I will read this case. So we have this patient, Leon Redcliffe, is 72 years of age. He lives alone with his elderly wife, who has had stroke, and he is her main carer. Yeah, they have no children. He was diagnosed with prostate cancer and now has metastatic spread. He developed severe scrotal edema whilst he was receiving palliative chemotherapy. The swelling has caused him such distress, anxiety, and fear. Scrotal edema. He cannot wear underpants and has to be very selective with the style of trousers he wears. He often resorts to wearing jogging bottoms because of the scrotal edema, the pain and embarrassment. He rarely goes out, relying on neighbors to help with him shopping and odd jobs around the house. His scrotal edema makes standing and sitting very difficult. He finds it difficult to get comfortable. He struggles to have a good night's sleep and there's now fluid seepage in the scrotum. What does that mean? I don't know. When performing, I don't know what does fluid seepage means. What does that mean? Do you know, guys? Fluid seepage. Oh, not fruit. Mechanical proportion of seepage fluids are related to distribution of most common owing greater consumption. Non-linear percolation theory for. Oops. Unfortunately, I don't have fluid, not fruit. Fluid. So the chance I didn't understand what does it mean, but I don't think it has very importance. So just don't pay attention. I don't know. I don't understand. I searched and I don't understand. When performing his activities of living and assisting his wife with hers, he is now finding all of this challenging as he also has metastatic spread to his bones. He is now refusing to have any more chemotherapy, and Leon has become very withdrawn. His general practitioner has arranged for a community nurse to visit and assess his needs and the needs of his wife, and the referral has been made for Mr. Redcliffe to attend the lymphedema clinic. Yeah, everything was said actually here. I mean, They mentioned everything. So full blood count, white blood cell count was increased, neutrophil number is normal, lymphocyte number normal, but yeah. Red blood cell count normal, hemoglobin normal, platelets normal. Take some time to reflect on this case and then consider the following. Explain the pathophysiology of factors associated with scrotal swelling. What may indicate that Mrs. Radcliffe may have an infection? Is clear Mr. Radcliffe is distressed? How can the healthcare team working in an integrated way assist Mr. Radcliffe from a psychosocial perspective? But first of all, about this scrotal swelling, I think this scrotal swelling, when they mentioned even, was because of lymphedema, because of the chemotherapy and the lymphedema. So lymph vessels was increased size. Yeah, maybe also infection. I don't know. What about psychosocial perspective? So he definitely needs support. I don't know. What might be proposed treatment consists of help reduce edema and control the pain? Skin that become edema. Well, what can you say, guys? What do you want to add anything? I don't know.
Maybe we should discuss with the patient that there's like different alternative as a treatment for cancer if the chemotherapy like got him where he is. So I
Yeah,
think that's a good option.
maybe actually, yeah. Maybe, I don't know. Mhm. Yeah, it's very sad, the story. Yeah, I don't know. Okay, man, thanks. Okay. Okay, this is important. Last one about the fluid and electrolyte. So furosemide, also known as Lasix. This is very high yield. As a healthcare professional, as a nurse, as a rehabilitation worker, rehabilitation doctor, because this is one of the most common drug, for example, cardiological department. This is diuretic, furosemide diuretic. One type of diuretic, because there are many type of diuretic. So I will read this medicine manual because it's very high yield. Because in hospital you always heard this name, furosemide or Lasix or Toragama. But okay, just remember this name, furosemide Lasix. This type of medication is known as a diuretic. It is often used to reduce edema. So during edema, fluid is accumulated, right? Diuretics, what the diuretics are doing? Diuretics increase the renal function to release, to evacuate water, the fluid. So less fluid will be accumulated and there will be decreased chance of development of edema. So used to reduce edema due to heart failure, hepatic impairment, or renal disease, and to treat hypertension. So this type of medication is known as a diuretic and is often used to reduce edema due to heart failure, hepatic impairment, or renal disease, or to treat hypertension. The drug works by inhibiting the reabsorption of sodium and chloride from the loop of Henle and distal renal tubule. It increases renal excretion of water, sodium, chloride, magnesium, potassium, and calcium. Therapeutically, the medication causes diuresis and subsequent mobilization of excess fluid. So, subsequent mobilization of the fluid. It can decrease blood pressure. The drug can be administered. So, okay, of course, you should be very careful. You should measure how many water, how many fluid patient took, and how many was released, because you should manage this balance. You should be careful because excessive urination, excessive fluid loss may cause a decrease the blood pressure. So you should be very careful. The drug can be administered orally, intramuscularly, intravenously. This medication is contraindicated in those who have hypersensitivity to drugs. It's very rare, I guess, because I have never seen, but patients, there will be patients with a hypersensitivity of the drug, hepatic coma, anuria. So anuria means no urinary output. It should be used with caution in severe hepatic disease, electrolyte depletion, because as we already mentioned, diuretics causes loss of sodium, chloride, calcium, I don't know, diabetes mellitus, hypoproteinemia, severe renal impairment. In the older person, there may be an increased risk of side effects, particularly hypotension and electrolyte imbalance. The drug should be taken as directed, recommending the patient to take missed doses as soon as possible. Don't double dose. Yeah, so it needs very careful. As a rule, when we are prescribing furosemide, we also prescribing the medication for the electrolytes, because as we already mentioned, patients loses lots of electrolytes. For example, we are prescribing magnesium, panangin. Those are drugs which contain magnesium, calcium, kali, potassium, sodium, potassium. So to give electrolytes which was lost. Advise the patient to change position slowly to minimize orthostatic hypotension, because the diuresis, there's increased chance of orthostatic hypotension. Orthostatic hypotension, that means that we spoke about it actually. So when the patient is laid down and quickly stands up, there's increased chance of fainting or hypotension, development of hypotension. So you should ask the patient to be careful. Orthostatic hypotension can be exacerbated if the patient uses alcohol, exercise during hot weather, or stands for long periods. A dietitian should advise, dietitian regarding diet high in potassium. Older patients are at risk of fails. Okay, I hope you understand, guys. Main topics. Was clear for you? This is very important. Okay. Just give me 1 minute to plug in the charger. Okay. Okay, let's continue. So today we have our last tutorial. So what do you prefer, guys? Should I speak about skin disorder quickly, or you will read this one at home? And should we have the different activities about previous chapter? Because we don't have time to do both of them. What do you prefer? Do the activities about previous chapter, or you prefer to finish and go quick to the skin chapter?
I mean, both are important, but I think activities is more fun.
Yeah, because you have also the midterm on Friday. Yeah, skin chapter is not a very difficult chapter. So skin cancer, melanoma, squamous cell carcinoma, eczema, though you have to read, and I don't think that if you read, I don't think that there will be a problem of understanding. Okay. When I was talking about activities, I was meaning the activities I had prepared last week. Those activities was, sorry. So those activities are from your book. For example, this one is about pain chapter. Fill in the blanks. Do you like to fill this blank with me about the pain chapter? Will it be fun for you guys? And you will, because I did not feel also it myself, and I will feel it with you, and then we can check together. What do you think? It's a good reminder, yeah. Okay, I will pick pen. Solomon, is it okay for you, man? Do you have opportunity to feel? Okay. Okay, I will bring the pen 1 minute. Okay, guys, sorry. Solomon, do you have the opportunity to do this activity? So we can start if it's okay for you. Solomon? Yes, okay, sorry guys. Well, let's start. Let's do by ourselves. I will do also because I don't know. Then we can check together. Okay, let's start. I don't, maybe 5 minutes will be more than enough. Let's see. Mm-hmm. Mm-hmm. Just 1 minute, guys. Okay, sorry guys, I will continue also. I guess I finished. It's not easy, actually. You should know this chapter quite well. I finished. Well, I'm not sure even with some. Okay. What about you guys? Okay, a bit. Okay. Solomon, what about you, man? Not all too. Okay, should we start or you still need more time? We can. Okay, okay, Solomon. Yeah, a bit. Okay, let's start. Let's start together. Okay. What do you prefer? Who should start? Do you prefer to read directly the correct answer, or you will read, or I don't know? How should we do? Um, I can read what I did. I can read what I did.
Maybe we
And
can
okay,
read.
from step to step.
I said maybe we can read
Okay,
and give suggestions on what should be appropriate for every.
okay, 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 yeah, okay. If you can you start?
Yeah, so I think the first one is okay. Hmm.
All right, let's read the
Yeah,
sentence.
pain is classified according to its duration. I think the first one.
Duration.
Mhm.
Okay.
Pain.
Okay, I think so. Oh, Solomon, what about you? Sorry,
I
man.
think it's
Okay.
location. No,
Duration, right?
location.
Yeah, I thought that
Look.
I thought that too, but next we have next like if we continue the superficial pain. So yeah, I was confused too.
I think it's duration because then after this sentence they are talking about acute, transient, chronic pain, and these pains are classified according to duration. Okay, but your option is optional also because pain can be classified according to the location, and they mention later superficial, deep. Okay, please continue, and then let's check together because I have correct answers also here. Next slide, so then we will check together. Okay, please continue,
So
Abed, and yeah, when you finish the first part, then I will ask Solomon to fire. I mean, yes, after the several sentences, Solomon will continue. Okay, please continue.
next we have pain of a short duration is a cold. I put acute pain. Uh,
Yeah.
yeah, and then I will start it with sudden pain. It's severe and associated with a I chose difficult onset. I don't know.
Okay. Okay. Solomon, what about you, man? What did you put? Which words?
So pain of short duration is called acute. Can you hear me?
Okay.
Acute.
Okay. Um, I
And
put.
next is chronic.
Huh?
Yeah, and the next is chronic.
Next is chronic. Okay, okay, okay. Just 1 minute. Yeah, I put transient. Pain is severe and associated with sudden onset. Okay. Okay. Let's. It's okay. We can then check. Okay, Solomon, continue, please. Yeah, next sentence, please.
So pain. Okay, it's called acute pain, and chronic pain is severe and associated with a sudden onset.
Okay, next one.
It stimulates the autonomic response,
Mhm.
and the patient can often present with tachycardia, tach- tachypnea, and hypertension.
Yeah. Actually, what should we do? Yeah, I should let each of you to read one time, each of you, and then we will check together because it's, I mean, it's chaos now when I ask you one sentence. Okay, I don't know. Whoever wants Abed or Solomon, let's finish one time, and then I will ask in a, I mean,
Oh,
in
I don't
a,
need to.
because Abed was reading first. Okay, let's ask Abed to finish. What did he put? And then Solomon you will read, and then we will see the correct answers. I think it's better because otherwise it's chaos. It will be chaos. Okay, Abed, please continue.
So yeah,
Thank you.
I agree with him on that part. So
Mhm.
uh, it does stimulate an autonomic response, and patient can often present with tachycardia and tachypnea and hypertension, of course, pain that continues even after healing has occurred as a chronic pain. Pain is also categorized according to its location. Deep pain can be, I didn't continue here, but yeah, deep
Yeah.
pain uh, can be, I guess, related to
Have you texted Dr.
organs,
Hassan?
I guess.
Text Dr. Oz, I'm going to be late. In his house.
Sorry.
Hmm?
Just give me 1 minute. Guys.
8:30.
I'm
Okay.
sorry. I have to review. Review. Madlova.
This stupid school that denied me admission. Just text him again.
Sorry, guys. Sorry. I'm sorry. Because it was very important goal. Should we continue? Abed Solomon? Sorry, because we are now.
Yes, we can continue.
Yeah, please. So Abed,
Yeah, I think superficial pain
yeah.
originates from the skin, I guess. So it's superficial, and deep pain emanates from body tissues. Deep
Mhm.
pain can be I don't didn't solve this one, but I think because of it's deep, I think the location is like from the organs, like deep organs,
Mhm.
meaning pain. Oh, okay, from joint, I guess, or is there's anything muscles? Yeah, we can put muscles.
Mhm.
Meaning locate. Okay. Okay. Meaning
Okay.
pain from. Um, I guess I will choose. Um, I don't know, to be honest. I didn't finish it completely, but yeah, maybe Solomon can help.
Okay. So okay. Okay. Thank you, Abed. So I will ask Solomon now to start from the beginning. Solomon, please start.
Okay, so pain is classified according to its duration. Pain of the short duration is called the acute pain. According to what I wrote, it was acute pain, and chronic pain is severe and also associated with a sudden onset, and it simulates an autonomic response. The patient can often present with tachycardia, tachyphonia, and hypertension. Pain that continues even after healing has occurred is acute pain, is chronic pain. Pain is also categorized according to its superficial pain or according to its duration. No, I think the first one was location, and this is going to be duration.
Location. Okay.
Superficial pain originates from the
Yeah. What about deep pain, man?
Superficial pain occurs from the from the skin, and deep pain emanates from the body tissue. Deep pain can be I think the muscle. I think the muscle.
Deep pain can be muscles. There's options visceral or somatic. Those words can be useful, I guess. Yeah. Okay, Solomon, do you want to finish this, or is it still you? Do you prefer now to read the explanation, or you can continue?
I think you can read the explanation now because everything is not very clear.
Okay. Thanks, man. Thanks, both of you. I think more this activity, interesting because it will be emphasize many important aspects of this chapter. Okay, let's read. Let's explain. Correct answers. So I will read. Pain is classified according to duration. Pain of a short duration is called transient pain. Oh, so first, short duration pain is transient pain. Acute pain is severe and associated with sudden onset. Yeah. So transient is short duration. Acute pain, yeah. It stimulates an autonomic response, and patients can often present with diaphoresis, tachycardia, and hypertension. And tachypnea also. Sorry. Pain that continues even after healing has occurred is chronic pain. Pain is also categorized according to the location. The superficial pain originates from the skin, and deep pain emanates from body tissue. Deep pain can be visceral, meaning pain from organs, or somatic, meaning pain from bones, muscle, and joints. Superficial pain is easy to locate, whereas locating deep pain is difficult. This is because the skin has a higher concentration of nociceptors. Actually, this was not difficult. Because we discussed all these details. I remember all these details when we was talking about this disorder, this chapter. Okay. Yeah. Okay, guys. we don't have left too much time. Should we finish or should we have one more activity? What do you prefer, guys? Should we finish? We should done today, or should we do one more activity? This presentation, right? Yeah, I will send it.
Yeah, Professor, is the midterm from like chapter 9 to like chapter 14?
Included 16.
Oh, okay, so till 16. Yeah.
Included 16. Skin and a musculoskeletal system, including this one.
Oh, okay.
But not fluid and electrolytes and skin. Those chapters will be in final exam. Questions will be in final exam. Okay. Okay, I guess we can finish actually, because I will send this presentation, Solomon. I have your mail, right? So, Solomon. So I will send those two presentations. Abed, you want also, or I send this presentation. I have also your mail. Anyway, I will send.
I mean, yeah, sure. Is it not on the drive though?
I think it will. I send this one musculoskeletal system to the Salome. I will send this one also, last one also Salome. But any case, I will send it in here also. Okay, guys. Okay. Yeah. So I have this last slide also prepared. So it's our last tutorial, guys. It's very emotional for me, emotionally, and but yeah, it was really interesting experience. It was new experience, of course, conducting lectures with the online system, and during this difficult time. So thank you for attending and watching my lectures. Really wish you all the best. I don't know. First of all, wish you better for the midterm, final exam. You should work very hard. Without working, you know that you can't achieve anything. Good luck in your profession as a nurse and rehabilitation doctor. And Yazan, you also man, as a nurse, I hope you achieve everything. Just hardworking, balance, and you can achieve anything. It was really interesting. I hope this subject became interesting chapter after this course. This book really is good book, and I tried more or less to make it interesting, because I think it's one of the fundamental important subject also. So I don't know. Here are my mails, Duru Mamrikishvili. So you can contact me, guys, anytime about anything. I don't know. When you will be back in Georgia, you are the foreigners in the country, and you can contact me for anything. Maybe not only about the studying process, or if you need any other help. Yeah. Thank you very much. And I really think that three of you deserve really good, I mean, everything good, because, yeah, I think I see the potential in most of you. Thank you. Yeah. Maybe next year this course is. Yeah. I have this practice to take the pictures together, but we can't take picture. Let's take screenshots. I don't know how to. I even don't know your faces, guys. I even don't know you. We may meet each other at Mercedes, and I don't know your faces outside. I mean, streets, and I don't know how to see. Yeah,
Maybe
how about the
hopefully next semester, yeah, we'll meet.
semester? Yeah, but I will not. I will. I will not knew who is Abed, who is Solomon, who is Yaza. So I don't know your faces. Do you know? Do you know how to screenshot? I. If it's okay to turn on the camera if you have, and take a screenshot to have for memory. But I don't know when I screenshotted only. Yeah, I am. I am. Oh, hello, so nice to see you. Uh, do you know how to screenshot to all of us will be? So please screenshot it if Abid has a camera also, and send me then. It's very strange, guys. I was we had the communication through these 15 weeks, and I even didn't know. And thank you also, guys, that during this during July when there's hot weather, you still actively involve the tutorial. So, yeah. Abed,
Uh,
do you have?
no, I don't in the PC, but I will send it via email.
Okay. Okay, Salman, can you screenshot? I don't know how to. Okay. Can you send me that screenshot? You'll send me on mail? Okay, let's send me on mail.
Yes, I'm doing it. Yeah.
Yeah. And Solomon, if you screenshot it. Okay, thank you guys one more time. And really, thank you very much. Really, I think that all of you have a potential to be really good in your profession because I see I'm doing 15 tutorial is not small amount. I mean, um, so thank you very much. Thank you for being there. Good luck to your life, and yeah, we are colleagues actually, healthcare professionals. Bye bye, bye bye, and I don't know. Yeah. Good luck in the midterms and the final exam. And as I told you, you can always mail me uh, on email wherever you need it and you want it. It's very emotional for me because 15 weeks we had this virtual lectures and now it's full of. But yeah, okay. Bye bye, guys. Stay
Yeah, yeah. I sent the picture, by the way. You should check it out.
stay strong. Okay. Be motivated. And okay. This is your picture. Okay, man. This is in Lisile? No, it's not.
Yeah, this is in Turtle Lake in Tbilisi. Yeah.
Turtle Lake. Okay, Turtle Lake. Okay, man. Okay, man. So I knew your face. Okay. Bye bye. Stay strong. Good luck. Thank you very much.
Yeah, see you. Thank you.
Bye bye.